Okay, so how did I get here? So after graduating high school, I went to a four-year college where I majored in biology. While I was there, I was able to play college basketball for 4 years. Then I graduated college, took the MCAT exam, applied to medical school, and got in, and my journey began. This is me here at my white coat ceremony, getting my first white coat. Medical school was a 4-year journey where you get to see all of medicine. And finally I decided to go into orthopedics, where I matched and was extremely happy to start. Orthopedic surgery residency training is 5 years overall, where you learn all of musculoskeletal medicine and how to treat patients of all ages. It can be a very long and grueling process, but it can also be a whole lot of fun. And you also work very hard, as you can tell from this picture of me leaving the operating room. After graduating residency, I did a orthopedic trauma fellowship where I fixed lots and lots of bones. Lots and lots of bones. You can see by these x-rays. One of the cooler things about orthopedics is that patients will come to you at sometimes their worst hour, and you're able to provide timely care to help them get back to doing the things that they want to and love to do. And then after finishing my orthopedic trauma fellowship, I chose to pursue a second fellowship in orthopedic sports medicine, which is my true passion. So here's what I did over the last couple days. So today I woke up around 5:30, got in my car. This is me driving to work. In the morning we had patients in the office to see. We also do a fair amount of teaching in the office. So after seeing patients in the morning, we went over, got some lunch, and then headed over to the basketball gym. One of the cool things about orthopedic sports medicine is that you get to work hand in hand with the athletic teams and the athletes. And this is a picture here of the Cameron Crazies camping out, waiting for their tickets. We then headed over to the practice facility, where we got a good practice in before heading out and traveling to Virginia Tech for our game. Another cool aspect of our job is that you got to be able to travel the team and see different stadiums and see different teams across the country. So this is going to Virginia Tech as we warm up and get ready for our game. This is a shoot around, players getting ready, and we're all part of the process, making sure the athletes are staying healthy. Unfortunately, there are injuries that happen in sports, but that's why we're here, to make sure we can get the players back to their full health and get them back on the court as soon as possible. After the game, we flew back home, got ready and rested for the next day. Today we're in the operating room at our ambulatory surgery center. This is probably my favorite part of the job, is getting to operate and fix people who are injured. So after looking through the list of cases for the day, we go to the scrub sink and scrub in so that we're ready to go for our first case of the day. We start off with some arthroscopy. Arthroscopy is a procedure we can do which is minimally invasive to help do things like repair rotator cuffs, help with meniscus repairs, with ACL surgery, amongst other things. Here in this video, this is after we get a tendon graft from a patient. We prep it so that we can use that as a replacement for their own ACL. So this is what we're doing here, is prepping the graft so that we can implant it into their knee. After we get the graft all prepped, we prep the knee now to be able to put the ACL graft back in the anatomic position where their native ACL was before it was injured. We also do some cool and innovative procedures. This one here is a procedure called the Bear, which is a new procedure to help heal the ACL instead of doing a full reconstruction or replacement of it. It uses a collagen matrix to help restore healing to their native ACL, and this is us kind of finishing the procedure now. Next, this is us repairing an Achilles tendon for a patient who had a sports injury while playing basketball. This after we're finished, making sure to test it and showing that the Achilles tendon now works again. After a long day's work, I like to come home to my family and spend time with them, who I've now converted into Duke fans. So thanks for spending a couple days with me. I think being an orthopedic surgeon is one of the most fun and rewarding jobs you can possibly do.